Hello, everybody. My name is Jerry O'Connor. I'm going to be the host for today's session. Uh, Welcome to our first session of the Washington Poison Center's 2022 Overdose Prevention, Harm Reduction, and Treatment Series. This is a live session. If you're joining us from YouTube or Facebook, it doesn't really matter. You can leave comments, questions there, and then our panelists will be able to answer those. We encourage you to ask questions. This is a panel of experts, so that's the whole reason for this, is to answer any questions from the public. Today our panel is going to discuss what an overdose response looks like from the point of view of first responders arriving at the scene, all the way to what happens as an individual is taken to the hospital. This is not just discussing overdoses to opioids. It can be any substance. And with that, I'm going to get our introductions started today. We're going to start with Dr. Sasha. If you would introduce yourself.
Hello, everybody. Good morning. My name is Dr. Sasha Kaiser. I'm I'm the Associate Medical Director here at the Washington Poison Center. My background is also emergency medicine, and so I have the unique perspective of being there when the patients come in the very beginning to the hospital setting, as well as being the person that gets contacted when somebody comes in with an unclear exposure or overdose, or when patients are calling from home for those concerns as well.
Let's keep going in clockwise. Dr. Marc?
Yeah.
Oh, okay, go ahead.
My name is Rebecca Rice. I'm a social worker with Eastside Fire and Rescue with our mobile integrated health program. And we follow up on certain 911 calls that the fire crews can refer to us after they've responded.
And I'm a firefighter, Ryan Olson, with Eastside Fire and Rescue. And I'm a line firefighter at one of our stations.
And my name is Marc Stern. Good morning, everybody, and thanks, Jared. I am a physician in Olympia, Washington. And relevant to today, I train the police departments in this neck of the woods, Olympia, Lacey, Tumwater, Yelm, in how to respond to overdoses from opioids.
Well, thank you, everybody. With that, we're going to start taking some questions. The first question is when someone is overdosing, who might respond to the situation? What is the very first thing that they do when they arrive at the situation? Marc, could you describe that?
Sure. And are we talking about technically first responders, or really anybody in the community?
Let's go from the point of view of a first responder. If a first responder, what do they look for the first thing they show up?
Sure. So it's important to talk about your own safety when, sometimes we have the adrenaline running, there's an emergency and we want to jump in, and it's always important to look around and make sure that you're not going to hurt yourself, because if you do, then you're not going to be much of a use to the person who needs help. So you want to make sure nothing's about to fall. You don't want to go grabbing and perhaps get stuck by a needle. So you just use some good common sense and make sure that you're safe and that you can now help the other person. And assuming that we may be talking about an overdose situation, the most important thing is to actually see if the person is asleep. Sometimes people just, for various reasons, fall asleep, and you just try to wake them up. You might rub on their chest. You might just speak loudly to them. Just make sure that they're not just sleeping, because it would be kind of embarrassing and to start to do something to somebody who's just maybe fell asleep. But then the next thing to do is to see if their heart is beating, and if it isn't, then we want to use our skills of CPR if we've trained in them. And the other thing at the same time, especially if there's somebody else around, you want to have them what we call trigger the EMS system. You want them to pick up the phone, call 911, say, hey, we've got an emergency, give them the address, so that emergency crews are coming at the same time that you're working on the patient, on the person who's there. Let me take a breath there and see how we're doing, and if anybody else wants to add anything.
Yeah, Dr. Stern, this is firefighter Olson. Yeah, just like you said, a lot of times when we're dispatched It is a dual response. A lot of times law enforcement is dispatched with us that can help us manage the scene if there's a threat to the safety of the crews and everything like that. And exactly to what the doctor said is really figuring out what you have. Is this somebody that is asleep? Is it something that could be a potential diabetic emergency? So you want to look at those things before you go down the road of a potential overdose. And then exactly that of ensuring that there's a pulse and that somebody is breathing. And if we find a pulseless patient, then it goes into the CPR route. If we do have the pulse, then the big key for us is oxygenation, because a lot of times, potentially in opioid overdoses, getting oxygen to that patient is the number one key, because if we can breathe for that patient, that gives them a very good chance for a good outcome. And then we start getting into other measures to try to counteract the effects of that opiate, if that's the drug that we're working with.
And Ryan said something really important, which is about opioid overdoses, which is oxygenation. People think that the fact that you're unconscious is what kills you if you have an opioid overdose, and that's not it. The way an opioid overdose kills you is by stopping your breathing. And as long as you're breathing and oxygenating, not just breathing, but also oxygenating, as Ryan points out, then there's no opioid emergency for the moment. But when somebody's not breathing adequately and they're therefore not oxygenating enough, that becomes an emergency. And for that, what you're looking at is how deeply they're breathing, how quickly they're breathing, and also especially at the color of their skin, the inside of their mouth, underneath the eyes, their fingernails. Those are places where you can really tell, does the color look normal? You can even compare it to your own color. Or does it look dusky, gray, pale, blue? Well, those are bad colors. And that means somebody's not, again, to use Ryan's word, not oxygenating well enough.
And just to kind of emphasize along those same points, a lot of the times when we think about overdose, especially right now, we think about opioid exposure, but this all is the same thing when we're looking at any other types of overdose as well, too. It's really going back to the basics. Again, the airway, the way that they are kind of exchanging that air, their circulation with their pulse, all of these things are the first thing that any first responder is looking at when they're coming into these scenes. And as far as after we stabilize those things, we can take a little bit closer look as far as what else they're looking like and whether or not we think this is consistent with a different type of exposure. But at the very beginning of all of this, the real basic parts of this are, again, the pulse and the breathing aspects.
Thank you. How do you determine that this is an overdose versus medical emergency, and how once you make that determination, what do you do that's different? Let's say if it was a medical emergency versus the overdose.
So I can speak to that. A lot of that is when you get on scene, you're using the information that you've gotten from dispatch, maybe on your way to the scene. And also, your situational awareness of talking to the individuals that are there and the presentation of the patient. So if you find somebody that they have a decreased level of consciousness, you see precursors to potential drug activity or anything, your brain can potentially be going that way. But I can list off numerous calls where it was kind of leading us that way, but we, as first responders, we go through a whole system of checking blood sugars, looking for any type of trauma and everything. So while we are, potentially using the information that we've received from dispatch and from people on scene, we always are having a level of suspicion that this could be potentially something else. And for us, it's looking at a lot of the vitals, making sure we check that blood sugar and trying to get as much history as we can, because that's definitely what we don't want to do is go down a road specifically for an overdose of some sort of medication or drug and have it be something totally different. So we have a whole slew of checklist systems that we put in place to make sure that we're not missing anything.
And on that aspect as well, too, one of the things that we're doing as we're going through this process is looking to see what is their response if we do end up giving an antidote, because that can help kind of inform us what to do next. And then the other part of this, too, when we're thinking about this from an opioid exposure potential, if that's one of the things that we are concerned about, giving an antidote like naloxone or Narcan is not going to cause further problems from other medical emergencies. And so if there is concern for this, we want you to go ahead and treat this, especially as a community member. If you are coming across somebody and there's a concern for an opioid overdose, we don't want you to be afraid to give Narcan because that there may be something else going on. It's just a matter of, as first responders, that's part of the training, is you have to consider the whole scene. If it leads you towards somebody who you think is an opioid overdose, treating them appropriately. If they don't respond, we're still continuing to look for other causes throughout that whole process.
To kind of dive a little deeper into that, let's say an individual is responding, not emergency personnel, but an actual individual that has naloxone on them, and they run into an individual that's what they suspect is overdosing, they're unconscious and stuff. Is it possible for them to harm this individual to administer this naloxone to the individual?
I'll take that. Naloxone is such a safe medication. It's been used so many times around the world. We have a history of it for many, many years. And there are some theoretical and rare complications from naloxone, but the potential for saving a life is so great that if you're a citizen and you have naloxone, and as Sasha was saying, if you have any reason to think, and I would almost say, even if you don't have a reason to think it's opioids, we hear about, 60 or 70-year-old people who you'd say, nah, there's no way they're doing drugs. And whether they knew it or not, they actually have an overdose. So going back to Ryan's point about oxygenation, I think for the person who ends up on a citizen who's seen somebody else, and if they think their oxygenation isn't good enough because they're not breathing well enough, there's such a low risk of giving naloxone that I can't think of very many situations. The only one that comes to mind, and see if Sasha, if you want to comment on it, would be a pregnant woman. Who is, if a pregnant woman is dependent on opioids, there is some possibility of causing a miscarriage. Again, Sasha, do you want to add anything? I can keep going.
Yeah, so I think these are always concerns that we may cause something, for instance, like precipitating withdrawal, causing them to have withdrawal symptoms. I think that this is a theoretical risk, and really what you have to assess is what's killing the patient. And so if a pregnant woman or anybody is dying because they are not breathing, you should give them the medication, and we can always look at treating that on the back end. There's lots of things that we have in place where we can manage your symptoms. So if, for instance, we give you this medicine and it puts you in withdrawals, and so patients are coming in and they're feeling sick to their stomach, they're nauseous, there are things that we can give you to help those symptoms afterwards, but really we have to make sure that you are breathing. And so I would not hesitate to give naloxone in those cases, because especially if we get them to the healthcare facility, we can help facilitate a lot of those treatments. And there is lots of data for decades regarding kind of the management of opioid dependent pregnant females that are coming in and kind of how to do this. But really, the patient is not breathing, so it's not only putting her at risk, it's putting the baby at risk too, and so we need to get them oxygen. So give them naloxone in those cases, as long as they're not oxygenating appropriately.
So again, the bottom line is that you should just have a very low threshold. You should not hesitate. If you think it, give it.
Absolutely.
So if they were overdosing on something else, giving them naloxone probably isn't going to have a reaction with the substance or have a harmful effect on the individual if it's not an actual opioid that they're overdosing on. Just want to see if that's correct.
That's a good point. And the other thing to keep in mind is that not only do people overdose or take more than one medication, one drug at the same time, sometimes they don't know what they've taken. And they may say, you're coming back again to Ryan's point about trying to collect information, but that sometimes that can be misleading. So the person can say, well, I took cocaine, and in fact, they don't know, but there was really fentanyl in it. So the history is a starting point, as he said, but if they're not oxygenating well, regardless of what you think they may have overdosed on, the naloxone, you thought naloxone, give naloxone.
Thanks, Dr. Stern. We're going to change the subject a little bit and kind of talk about if a patient, when an individual does overdose and someone arrives on the scene, do they always go to the hospital, or sometimes are they treated at the scene and are able to be discharged there?
So I can speak just, I guess, first on that. So no, there's been oftentimes where we have administered Narcan or naloxone, and the patient has started to breathe, and the symptoms have subsided. And when we take the vitals, all the vitals are looking good. The biggest key there is educating the patient and having them understand that while right now you're breathing on your own and you're breathing fine, there is a time period of this drug, and you can very easily slip back into a situation where you're not breathing again. And so always our recommendation is to be transported to the hospital, because there has been times when we have a patient sign against medical advice and we leave them with a competent individual and have left aftercare instructions, and they could potentially 10 to 15 minutes later be back in the same situation. And so while yes, people can be left at home, it still is always the recommendation that when we're on scene that they be transported. And also, by being transported to the hospital, there are services that can help be provided to those individuals at that time.
What I'd like to add to that, and I agree with everything Ryan said, I've run into a lot of people who refuse to go to the hospital. When the fire department comes, or the police department, they've administered naloxone, the person wakes up and they refuse to go. And for all the reasons he said, we really want them to go. But if you're in a situation where your friend or family member or just a stranger is refusing to go to the hospital, also hopefully you've called 911 and first responders are going to come. But even if, let's say, the person wants to leave the scene before that happens, but for the reasons that Ryan said, you really want to encourage somebody to stay with them for the next hour or two, because of what he said, that the naloxone can wear off a lot more quickly than the drug wears off. And so if it's a friend or family member, say, stay with Joe. Don't leave his side for the next couple of hours. And here's perhaps if you had an extra naloxone, you might give it to him and say, here's how you use it. And if Joe starts to not do well again, you can administer it and call 911 right away, but don't leave his side for another hour or two.
Dr. Kaiser, could you talk about when they do end up in the hospital, how are they going to treat them a little differently than if they were actually treating themselves with naloxone in the case that they don't want to go to the emergency room?
Absolutely. So when you come into the emergency department with a presentation that's consistent with having some kind of opioid exposure, one of the things that we're going to do is we're going to put a special cannula in your nose so we can see how well you are breathing. You'll also have a finger probe, which will tell us what your oxygen saturation is as well. And what we're really trying to see with this is kind of how you continue to breathe throughout this process. Narcan, naloxone, is a life-saving drug, but as everybody has mentioned, it has a time period that it works. And if you have taken something that has a longer duration of action, then you could have a lot of those opioid features come back. And so what we're trying to make sure that we do when you're in the emergency room is watch you beyond the time that naloxone is working to make sure that those symptoms don't come back. And this can be affected by the type of drug that you use, how you use it, because the absorption and the duration of action can be very different if you are smoking it, injecting it, snorting it, or taking it by mouth and eating it. So all of those things are a big play in this. In addition to that, a lot of times what we're doing too is, again, going along with some of this prevention aspect, is talking with the patient about what happened, talking with them about their risk factors. If they don't have naloxone already, what we're looking at doing is making sure that they have it and know how to use it. But part of the limitations with that is if you are the one who is getting sick because of an opioid, you're not going to be giving yourself naloxone. And so really making sure that these patients understand that if you're going to continue to use, you need to use in a safe environment, and people around you need to know how to use the naloxone. And so a lot of times there's some teaching with that part of it too. The other part of this is looking to see how your exam is changing over time. Is this somebody who looks like it is just opioids that we're worried about, or is there other things that they were using that are causing other problems? So for instance, if this is somebody who has used both cocaine and fentanyl, we're looking to see, are we seeing effects of the cocaine that are becoming the bigger problem? Are we worried about your heart? Are we worried about your blood pressure? Are we worried about whether or not you're having any weakness on one side or the other that can be related to some of these drugs? And then the other part of this as well too is, depending on what happened, we may be looking at, is this something that was done on purpose, or is this something that was done because you were trying to get high? And if this is something you were done on purpose, what other things do we need to do to kind of support you through this process? We may be looking at putting an IV in your arm and getting some blood levels. We may be looking at checking your heart as well too. So a lot of it really depends on how you responded to what was given to you pre-hospital, if you were given anything, how you're changing over time, what resources we can give you, and what else we need to do to make you safe. So it really just kind of depends on what you look like when you come in.
Thank you. Rebecca, can you highlight the key points of the Good Samaritan law? I think that's a law that everybody should know about in Washington.
Yeah, so this is kind of the law that would apply to me and other non-medical professionals if we come across someone who has overdosed or is just otherwise, in medical distress. And basically, as long as we don't exceed our knowledge or our skill set, we can provide care. So if I come across someone whose heart has stopped, I could do CPR. Since I've gone through CPR training, I wouldn't, attempt to do surgery on someone or something, just like a firefighter wouldn't. We transport them to the hospital. So same with Narcan or naloxone, we can do that as citizens because we all have the skill to insert something in someone's nose and spray it. So as long as you're really not exceeding your general knowledge, you can help someone who is having a medical issue, on the street or in your house or wherever. And you won't be prosecuted, basically, assuming something goes wrong. Like if they did have some rare reaction to naloxone or something like that.
Thank you for answering that question. So pretty much when it comes to naloxone, is there some training that you can get for it? Is it online or anything like that you can find that will teach you how to use naloxone? Because you said exceeding your training per se.
There are trainings. I know I've worked at agencies where we have naloxone on site, and we had a training. And I think that the kits often, like in King County, you can order a naloxone kit just as a private citizen to have at your house. And I believe it comes with like a little instructional paper. I don't believe training for naloxone, and doctors, correct me if I'm wrong, is required because if you haven't seen it, it's so obvious. It's just like a little nasal spray thing, like almost looks like something for allergies or something. So I think it would be challenging to injure someone with it. I think the danger would be, like you said, you have to get it kind of far up their nose. So it's possible you wouldn't put it up far enough.
Yeah, a lot of fire agencies around the state now are carrying naloxone to give to the general public. And here in Eastside Fire and Rescue's jurisdiction, we have very easy to follow directions on how to use the drug that we're giving individuals. The biggest thing to remember is it's not going to do a lot if you don't get the mist up into the nasal cavity. If you don't forcefully put it in the nasal cavity, it tends to kind of drip out. And so, that forceful application really gets it up into the receptors that can save a life.
But still, always call 911.
Absolutely. And I would say too that any way that you can familiarize yourself with this before something happens is always helpful. So it's very easy to just Google, look at YouTube, also go to your local pharmacy. Again, there's a lot of different ways that you can access this in the state of Washington. It is state by state dependent, but the more that you feel comfortable with the product, the more likely you are to use it. And especially if anybody in your life uses opioids, knowing and feeling comfortable when it comes to a point where they're not breathing is going to go a long way in saving their life. If you guys have other questions as well too, I think going to your healthcare provider, whatever that looks like, can be very, very helpful.
There's one other law, Ryan, that people should be aware of, and it may technically be part of the Good Samaritan law, but I think sometimes people who are hanging out with people who use drugs are sometimes themselves in possession, and they may be hesitancy to call 911. And in Washington State, you have protection against that. If you possess your own drugs and your colleague is out and you call 911 and the police come, first of all, you should stay there and try to help them. And the police can't arrest you as the person who was the bystander and helping out if you just are merely possessing drugs. So that's an important protection that people should know exists.
One last question. We're almost at the end here. What is something you'd like all viewers to keep in mind regarding overdose safety? And Marc, you can go first since you might have to leave.
I think you may have been one of the other folks who mentioned this, but it's called harm reduction. We certainly don't want to encourage people to use dangerous drugs, but if you are going to use, you want to reduce the risk or harm to yourself. And I don't remember who mentioned it, but one of the most important things is don't use drugs alone. Use drugs someplace where there are other people around who are also not using at the moment, just like having a designated driver. And so if something happens to you, they're there. And then the second thing we've also mentioned is you want to help encourage the people around you to be carrying naloxone so that if something happens to you, they have it and vice versa. Those would be the two things I would think of.
I think one other thing, and we mentioned this a little bit earlier, and specifically with opioids, the Narcan will definitely affect that drug and stop that drug interaction. But if drugs have been mixed and someone is using multiple drugs, say cocaine and something else, a stimulant or something like that is not going to be affected. And so everybody reacts differently to different drugs. And so while we might get the respiratory drive back from a opioid type overdose, if there are other drugs on board, as somebody helping a patient or helping a friend, knowing that when that person does wake up and they start breathing, they still could potentially be feeling the effects of other drugs that the Narcan did not touch. And so keeping that situational awareness and trying to keep the scene calm and not getting yourself into a bad situation.
And I think too, just to kind of emphasize along that point is, especially nowadays, you never know what's going to be in your drugs. And so you may think that you're using one thing and have a completely different response. Even if you weren't looking at having an opioid high, you may still get one from using something else. And so I think the big take-home points with this is that if you think naloxone, use naloxone. Do not be worried about causing bad outcomes to happen with this. It's something that potentially is a life-saving event. There's lots of ways to access this, to have it on your person at any time. So I think that we had put on the banner below the stopoverdose.org. That's a great website to look at. There's lots of ways in Washington to go ahead and be able to have that on your person just as a citizen without requiring a prescription for this. So look into that. And then if these things happen, please, please, please call 911, because as Fireman Olson mentioned, there are lots of other things that can happen, even if you've given the naloxone, that we want to make sure that this patient continues to be safe and that there's not other side effects or other drug features that are causing them to be at risk as well too. And two, I think the last thing with this is the Poison Center is always here. If you have any questions, this is a free service. This is open to everybody, for phone calls from the home, for phone calls from the healthcare facilities, from everywhere. Our number, 1-800-222-1222. We are here 24/7. Please use us.
With that, I think we're going to adjourn our session. We appreciate everybody that logged in to watch today. And please leave some comments and questions still if you're going to watch this on the recording. I appreciate all our panelists being here. Excellent questions and answers today. I really enjoyed this discussion.
Thank you so much for having us.
Same here.